Okay, good morning, students.
Good morning, sir.
Social system and social organization. Last class we had been learned that systems and organizations and bureaucracy as well as we had been analyzed. Today we are going to start with voluntary association or organization. Here two words are available, voluntary and association. What do you mean by voluntary? Voluntary means a person own or individually do something. Association means two or more persons. Okay? Two or more persons together and do some voluntary actions. First meaning. The term voluntarism is derived from Latin volunteers, which means will or freedom, freedom of associations. Simply says voluntary association means freedom of association. Definition: keywords should be keep with your mind. It is a organization, group of individuals enter in agreement as volunteers to form a body or organization to common interest and accomplish purpose. So what are the keywords? Group of individuals, underline. Then agreement, every individuals agree with each other, do some voluntary work. Then common interest, a particular aim for every voluntary associations and purpose. Indian Constitution, Article 19(1)(c) confirms Indian citizens right to form association. So in India, every individual right to form association, it is a fundamental rights, constitutional rights. Characteristics of Indian Constitution, legislations, look at this legislations, Societies Registration Act 1880, Indian Trust Act 1882, Cooperative Societies Act 1904, Then Joint Stock Companies Act 1959. Then, so these are the legislations explain about the nature and scope of every NGOs. Every non-governmental organization should be registered under these legislations. So then history in 1839 first started. In 1914, 1083 NGOs. After United Nations was started, the NGOs empowered by these United Nations by UN Charter. "27 recognized NGOs is suitable and mainly sustainable development. Welfare state, 20th century globalization is improving importance of NGOs. Then Fifth World Forum, there 1000 NGOs are associated and try to improve the volunteers' actions. Then characters, aim and objectives program. Next, administrative structure, executive committee, governed by its own members, democratic principles, raise funds for its activities. Then forms of or factors motivating voluntary action: government, business, philanthropy, public interest. Next, religion, personal interest, etc. Already we have discussed. Knowledge and prestige create values, idealistic, education, psychological and social, community and classes, ethnicity, sex, age. Types of NGOs: charitable orientation, service orientation, participatory orientation, empowering orientation. NGOs type by level of cooperation: community corporations, city corporations, national NGOs, international NGOs, etc. Then functions of voluntary organizations. First function, improve sociability. So here we are going to real discussions. Sociability means including relationship between the people to promote sustainable development. Next, develop democratic system. What do you think about democratic? Democratic, for the people, by the people, of the people. So NGOs or voluntary organizations support to democratic system. Then enables learn. The aim to promote knowledge of the people and create awareness. Then helps groups and individuals. For example, family welfare organization, support to familial groups. Then to meet all needs of the citizen. What do you think about what are the needs? Physiological needs, social needs, For example, educational needs are satisfied by, fulfilled by educational voluntary organizations. Then help the states. States means government. Okay, states means government. The voluntary organization help to government for implement various program, including healthcare program, for example, family planning program, implemented through private organization, private hospitals, Next, sustainable development. Sustainable development by means of nature friendly development or environmental friendly development. Next, building together people, which means increasing the cooperation and coordination among the people and groups. Next, educating member of the public. The educational voluntary organization educate, for example, different types of educations, including primary, secondary, medical education by the private and NGOs. Next, meet the healthcare requirements. Healthcare organization, for example, hospitals, nursing homes, having provide, private, not government, non-governmental hospital, to meet the healthcare needs of the people. Then non-profitable, non-political functions. So maximum of NGOs, non-voluntary organizations, they don't think about profit, only think about welfare of the people. They do not participate in any political parties, only concerning well-being of the people. Then examples for voluntary associations. Indian Red Cross Society first. Second, Child Welfare Council in India. Third, tuberculosis, association for that people who are. Then Bharat Sevak Samaj. Then Central Social Welfare Board, Kasturiba Memorial Fund, All India Women Conference, All India Blind Relief Society, international bilateral agencies. For example, Rockefeller Foundation. So this is a foundation for international NGO and provide various services. Then Ford Foundation, then CARE, Cooperation for American Relief everywhere. Next, voluntary health organizations. Students, we are nurses, need to think about focus on healthcare organizations. As we know that maximum of hospitals in India is private, corporate hospitals, NGOs, companies. For example, Apollo hospitals, corporate, AIMS, as well Fords. So various government healthcare program only implemented through private hospitals. So we need to know about. Define. Non-profit, non-governmental agency. It is a healthcare agency, okay? Organized national, state, local level. Purpose is that health related supported. Mainly supported by voluntary public contributions. So maximum of non-profit organizations, NGOs, they collect money from the people and use that money for healthcare services. Then functions of voluntary health organization. First function, improving health status, health for all. Second, develop healthcare infrastructure, mainly new hospitals. Infrastructure means the facilities, multi-speciality hospitals. Then concern individual health by means of various individual healthcare services. Then promote health and prevent diseases. Various prevention programs organized by voluntary healthcare associations. Then meet healthcare needs of citizens in every country, mainly in India. Then helps the government. Students, this point is very important. The NGOs always help to government to, for example, implement various healthcare program, mainly immunization program, family planning program, etc. Then attain on sustainable peace and development, which is important factor. This health is a pillar of peace. Okay, health is pillar of peace. Is help to develop sustainable development goals. Then coordinate the healthcare activities, including government as well as non-government. Then provide health education to the public. Then to identify, meet healthcare requirements concerning new facilities and specialties. It is a non-participation and non-political healthcare organization. Okay? Healthcare organization. Then voluntary organization versus health. Students in our society, the voluntary health organization following services. First service is that promote health by means of health education, environmental modification, etc. Immunization. Then provide welfare services, including child welfare, women welfare, and welfare for disabled and old age, etc. Then HIV/AIDS control. So various NGOs only for HIV/AIDS control. Then promote nutritional status, which means malnutrition control programs. Then role of NEDs on voluntary organizations. Participate to formulate program, planning welfare programs, implementing programs, then validating health promotional activities. So these are the role of NEDs on voluntary health associations. This fact is that maximum of hospitals, the maximum number of healthcare professionals or nurses to do vital role to promote welfare in our society through non-governmental actions by the nurses. Next section, role and status. Role and status. Status refers to what a person is. Role refers to behavior expected of people in a status. Role, meaning, position, function, responsibility, job. Students, every members in a particular organization having a role, or which may be called as job. Define role. Social role is a set of connected behavior, rights, obligations, conceptualized by actors. In social situations, it is an expected or free or continuously changing behavior, individual, social status, or social positions. Students, keep keywords: set of connected behavior, right and obligation. We know that every job having a particular position, obligation means responsibilities. So every role having a status. For example, in hospitals, status for nurses or doctors, like this. Then social role position. First is that specialized positions. For example, in hospitals, a particular nurse specialized in theater, then guided by social norms concerning social rules and regulations. For example, in family setting. Then role are occupied by individuals who are called actors. Actors means who behave particular mode of behavior according to their role, which is determine the status. Then consider the role legitimate. Legitimate means is a legally defined. Then social pressure are likely to lead to role change. Then anticipation of rewards and punishment. So role is determined to rewards and their individual enrichment. Then determinants and characteristics of role. First determinant, social influence. For example, in family, role of father, mother, Then genetic predisposition, which is concerning this genetic. Father having good role, the same role may be done by their own children's. Genetic factors, biological. Then cultural influences, including material factors and non-material cultural factors. Then situational influences. The situational influences including family situations or situations in the workplaces, etc. Which is determine the responsibilities. Then role theories, functional role theories. These theories emphasize that functions of a person determine the role. Then symbolic interaction role theory. This theory emphasizes that different factors interact to form a role. Then structural role theory. For example, organizational structure determine the role of a person. Then organizational role theory. So this role theory is a management studies. Role of a person in a particular organization, including educational institutions, or political organization, etc. Then cognitive role theory. This theory emphasizes that the knowledge of a person influence role. Then social action theory, which means social behavior, is component of this influence the role. Next, social norms theory. Norms means rules and regulations in the society influence the role. Then role conflict. Role conflict means when one is forced to take on two different incompetent roles at the same time. For example, we are nurses working in a hospital. At a time, two roles may be done, able to try to do in some situations. That time we may be experience conflict. Doctor's role and nurse's role. So that is condition is called role conflict. Conflict between two incompetent roles at a time. Next, status. Status is a concept is concerning condition or state. Students, status determined by role. The person doing highest role in a society experiencing high status. Definition, synonym for honor. Honor means respect by other people. For example, in a hospital, higher, for example, supervisory nurses, control, prestige. Then social status denotes the relative position of a person on a publicly recognized scale, hierarchy of social worth. Hierarchy means, for example, top position become top role become top status, high status. For example, in hospitals, nursing superintendent become a highest status in nursing section. Then characteristics of status. Result of need. Okay, students, status, if a person fulfill highest need in the society become high status. Then degree of authority. If a person higher status having highest power authority to control the society. Then social system related with it. Then indicates social stratification. What do you think about social stratification? Division of society. If a person having highest status, they having highest position or class. Then status has some degree of prestige. Prestige means dignity. Then right to remunerate. Remunerate means benefit or salaries. For example, in organizations, high role, high salary, high status, like this. Then status cannot be isolated from role, which is a fact. Already we have discussed. So status and role interrelated phenomena. High role, high status. Okay. Then types of status. Ascribed status, achieved status, social status, economic status. Students, this question is very, very important in the examinations. Okay. Ascribed status means a status derived from generation to generation. For example, caste groups. Achieve means achievement by means of educational achievement, economic achievement. Social status means the society. Economic status money or wealth, legal status according to legislation, status geo, then status symbolical, then family status, for example, father, mother, then religious status, whether which belong to which particular which religion, you know, these are the types of status. The examination very important. Then social institutions, next section. Terminology, social interaction or companionship. Institution were well established, structured pattern of behavior of relationship that accepted as fundamental part of culture. So social institution we will learn next class. Now questioning time. Thank you. So excellent. Thank you for response. Thank you everyone. Have a wonderful day.